my name is Valentina González from the Parallel A. Today I'm going to talk about the partial oral versus intravenous antibiotic treatment of the endocarditis. First, I will give you a short definition. Endocarditis is an inflammation of the inner lining of the heart chambers and valves, called the endocardium. Usually, this inflammation is caused by a bacterial infection which grows into a valvular vegetation, and the bacteria that cause the disease are Streptococcus and Staphylococcus, and in rare cases due to a fungal infections. Now we are going to see a little video about this.
Bacterial endocarditis occurs when bacteria enters the patient's venous system and is then deposited on the endocardium or on a valve in the heart, where it's then able to grow. If it's deposited on a valve, it's most commonly the tricuspid valve, because that's the first valve that blood passes through on its way around the heart. Also, if it's deposited on a valve, it's more difficult for the body to actually fight the infection, because each leaflet only has one blood supply. Common causes of bacterial endocarditis include intravenous drug use, bacteria that's in the syringe, and bacteria that's actually on the patient's skin are directly injected into the venous system, cardiac surgery, congenital defects where blood from one area of the heart is able to mix with blood from another area of the heart. An example of this is an atrial septal defect where blood from the right atrium and blood from the left atrium are able to mix. Also, dental work, which is why patients with certain congenital defects and certain heart conditions have to have antibiotics before they can have any dental treatment. Signs and symptoms include a low-grade fever, subungual hemorrhages, which are also known as splinter hemorrhages. Subungual hemorrhages are red linear lesions that occur beneath the patient's nails, Osler nodes, which are small painful bumps that occur on the fingers and toes, Janeway lesions, which are spots on the hands and feet, Roth spots, which are oval-shaped lesions that have a clear spot in the middle, and those actually occur in the patient's retina. And the patient may also have a new onset murmur due to the valve becoming stenotic from the growth of the bacteria. Unless bacterial endocarditis is treated quickly, it is fatal. If you would like to learn more about bacterial endocarditis, you can check out the links below. Have a good day.
And this picture shows what is the endocarditis. The applications in medicine. Patients with infective endocarditis on the left side of the heart are typically treated with intravenous antibiotic agents for up to 6 weeks. It's unknown whether a change from intravenous to oral antibiotic once the patient is in a stable condition will result in efficacy and safety, similar to those with continuous intravenous therapy. And another video. The pros and cons. Partial oral. Pros is the most widely used way of administration of drugs. Cons. It can be used in patients with difficulty swallowing, with vomit, or they are unconscious. Intravenous antibiotic. Pros is the fastest method to introduce medication. Cons. Very fast administration can cause undesirable effects.
This is a big one, antibiotics. A lot of parents worry about giving them. Is overuse becoming a problem?
Absolutely. Unfortunately, overuse is a big problem because overuse of bacteria causes something called bacterial resistance. So the bacteria, the common bacteria that we've always had around, are morphing and changing and becoming resistant to the bacteria, to the antibiotics that we have created. And we actually have not created new antibiotics in many years. So we're still using the same ones. So it's very scary.
So do you have a lot of parents come in and they say, or grandparents or caregivers, I need antibiotics for my child, and you say, well, I don't think you need them, and they say, no, I need them.
Absolutely.
It's not easy.
It's very difficult because medicine is not black and white. Medicine is it's truly an art. And, I had attendings that used to tell me that, and mentors, and I never understood until I came into practice. There's the psychosocial aspect of the family, there's the relationship you have with the parents, and then there's the actual illness that comes into play.
Yes.
And it's very difficult because some families say, well, I know it's going to progress in 3 days because this always happens to my child. I don't want to come back. I can't take off of work again. Please give me the antibiotics now. Or we're going on out of town and I don't want to get stuck out of town without antibiotics. Please prescribe them to me now. Or just, I think that it'll work. So-and-so's done it before, it's worked before, so I want it now.
Exactly. And not only the antibiotic as a whole, and it's a good thing if it's needed and used correctly.
Right.
But there can be side effects.
Exactly.
And I'm allergic to penicillin.
Okay.
I blew up in a rash or something. Case in point, my daughter the other day had to take an antibiotic with sulfa.
Oh. Yes.
I don't even have to tell you.
Yes.
Poor child, covered in a rash
Yes.
horrifically, so now she's jotting down that allergy. You have to be wary of the fact that if you're starting an antibiotic, that could happen.
You could possibly be allergic. Also, antibiotics, they kill the bacteria in your body, good or bad. It kills the bacteria that's causing the infection, but it also kills the good bacteria that we have in our gut. As a result, you develop diarrhea or a very, very severe infection called Clostridium difficile. And we've seen that on the rise in the pediatric community.
Issue apply in Ecuador. In Ecuador, for the treatment of endocarditis, the intravenous route is the preferred because of its maximum efficacy. Commonly used drugs are inhibitors of the cell wall synthesis, such as gentamicin. And for the conclusion, in the patients with endocarditis on the left side of the heart who were in a stable condition, changing to the oral antibiotic treatment was non-inferior to continue intravenous antibiotic treatment. Thank you.